Greetings. Let's talk about staying at home during this time of the coronavirus. And I can say that, and I'm not worried about saying it because I'm not getting monetized by YouTube anyway right now. So they can't say, okay, we're demonetizing you. And that's not what this is really about anyway. I want to talk about the reasons that this is different than when I did my video years ago where I talked about the flu shot being a scam. And it's interesting because that video has been getting a lot of visits lately because it was just talking about the regular flu shot back in the day. And it's a totally different thing that we're dealing with now than we do with the flu shot. And I'm just going to glance over this real quickly with the regular flu shot. The reason I said back then that the flu shot was a scam is because there's actually 4 different flu shots that they have set up around the country. And they try to guess which strain they think it's going to be. And then that's the shot that they give for your area. The thing is that even when they give it, usually at best, it's 33% effective because they're guessing what it is. So they may not get it right. Also, if you've got people who are traveling, then you've just pretty much thrown it out the window. And also, they set it up so that you can't sue the manufacturers of the flu shot. There are a lot of people who end up getting Guillain-Barré syndrome. I hope I pronounced that correctly. And a lot of those people can't apply for unemployment. They can't apply for disability. And a lot of those people are out 6 to 8 months because they have to relearn how to walk and how to move and how to take care of themselves. That's a pretty serious disease. And in some states like New York, it's mandatory for healthcare workers, those who actually work with patients, to get the flu shot. Otherwise, they lose money from Medicare. Children's hospitals, believe it or not, it is not mandatory for anyone to get a flu shot at a children's hospital. Why? Because they don't accept Medicare, because there's no children on Medicare. But children are some of the most vulnerable people in the country to the regular flu. That's why I said the flu shot is a scam. This is a totally different animal, though, because there are hundreds of thousands of people who have the COVID-19 virus, but they don't have any symptoms. They don't actually ever get sick, but they could be a carrier. They could be passing it on to someone else. And we don't know about them because there's not enough test kits. There just aren't enough test kits everywhere. And that's really what makes it scary. You don't necessarily know if the next person you see might have it or if they may give it to you. Or maybe you're giving it to someone. You just don't really know. That's why we have the masks. That's why they ask us to stay at home as much as possible. That's why there's so many businesses that have been closed and shut down, except for grocery stores. Thank goodness for grocery stores and convenience stores and other different types of stores. Thank goodness for restaurants that can provide pickup or delivery because we need stuff like that. Heck, thank goodness for the people who are creating content on YouTube or this TikTok thing or Instagram TV because there's a lot of that stuff that's being consumed these days. And that's why we're all wearing masks when we go out. And more people now are starting to wear rubber gloves or nitrile gloves. I wear nitrile or plastic gloves. We're being a little bit more wary about what we might be touching behind someone else. There are some people, and I have to say it that way, who are washing their food packages when they get back home. That's something totally different. I did that for a couple of days. I said, you know what, I'm not doing that anymore. I'm just not going to do it. I'm wearing my nitrile gloves. Now, what I will do is I come home and I let stuff sit for a little while, except for the stuff that has to go in the refrigerator. But, you know, you can overdo it and you can let it drive you nuts, but you need to be careful. And I was talking to a friend of mine on Facebook last week when I posted something because the governor of New York State wanted everybody to now have to wear a mask to be able to go into certain grocery stores. And he thought it was ridiculous, but he lives in Colorado. And I said to him, well, no, actually, it's kind of a thing where if people don't know that they have it, they could pass it on. And so you wear the mask so you don't pass it on, but you also wear the mask because there are some people who have it who aren't wearing the mask, who may cough, and you just may ingest it. It is airborne in that way. And I also mentioned that I've got my mother living with me. She's 82 years old, which makes her vulnerable. I'm 60. I'm in that age group, and I'm also diabetic. So, and I'm black. African American if you want to be. I'm black. And so I hit a whole bunch of factors. Mom hits 2, I hit 3, and she also has high blood pressure, but Mom hasn't left the house. So, you know, we're kind of vulnerable. That's just how that is. So you have to protect yourselves. But the stay-at-home thing does not mean you can't get out. There are some people who think you can't go out for a walk. Sure, you can go out for a walk. You can stay 6 feet away from people. You can walk at the park. You can walk around your neighborhood. You can walk, well, wherever you can walk. You're not going to be walking at the gym, and you wouldn't want to be there anyway because all those sweaty people, yeah, you just can't get away from them. You just can't do it. But you can go out. You can go to the store. As long as you're protected. All the stores now, at least in my area, I'm assuming it's the same everywhere else across the country, have barriers set up, usually using orange tape so that you know to stay 6 feet away. Our stores have now gone to all the large grocery baskets. We had like the small ones and you had the big ones, and I guess the big ones, basically if you're behind one of those things, you're 6 feet away from the person in front of you. So thank you for that. Glad they didn't get rid of those. And, you know, there's so many people who are trying to help you to stay safe, and they're trying to stay safe on their own. They're wiping down all kinds of things. You can get out for a little bit. Heck, you can get in your own car and drive. And if you live in a warm place, open up your windows and get some air and just drive. Because I have someone who comes twice a week, and those couple of days she sits with Mom for a couple hours so I can go out shopping. She's only leaving her house once a week, not including coming to my house. And she goes once a week to go out and get groceries for the week. And she's the one who made my masks along with her masks. And, you know, we're being as cautious as we can. But she also walks her dog. So she gets out every day, at least twice a day. Maybe it's 3 times a day. I don't know how many times people walk their dogs because I don't have one. But, you know, she's out there and she's walking. And when she's walking, she's not wearing a mask outside because you're outside. And here it's still cold. So, you know, it's going to drop. By the time you see this video, the temperature is probably going to be around 20 degrees. Thank you, spring. Goodness, it was warmer in February than it is right now. And we've had snow 5 out of the last 7 days. So this is Central New York for you. So I just wanted to kind of say that, you know, a lot of people are talking to each other on Skype, and Zoom has turned out to be the new thing. I haven't used any of that stuff yet. I have talked to a couple more people on the telephone than I usually do, which is interesting. And I'm trying to do some other things to keep myself engaged. I'm at least used to being in the house a lot. But I'm also used to being able to just go out for an hour and a half, and sit at a restaurant and eat lunch every once in a while. I can't necessarily do that, but some of those places deliver. You can't be mad at that. So please, take care of yourself, take care of your family. Get out, even if you have to go in the backyard and walk, which, by the way, I only did that once because then I started coughing and sneezing a little bit because it's allergy season. And nature doesn't like me. I don't like nature. That's just how it is. So, y'all take care of yourselves, and let's see how we do over the next week. Talk to you later.